type them into the chat, and I will answer them during the Q&A at the end. So, all right. So I'm really excited to talk about the history of Courage Health, where we started, where we are today, and where we're going. I think, there we go. Okay. So for 25 years, we've helped individuals facing cancer and then other chronic health conditions uh, reclaim their strength, hope, quality of life through medical exercise, and then the support services that we're able to provide. And this has been done at no charge. That's something that I know that Dr. Kimmel felt very strongly about. And I know he would be very proud of the fact that to this day, that's continuing. So we want to look back where we started, celebrate where we are today, and then talk about the future and what we're looking forward to next. As I work through the presentation, be on the lookout for fun facts that will pop up at the bottom of the slides. I think there's some really cool information there. Some of it's pretty fun too. All right. This is our mission and vision. These are the guiding principles of Courage Health. So our mission statement, we empower individuals living with chronic health conditions to take active steps to renew life. Our programs boost physical strength, lift spirits, and promote lifelong wellness. And our vision statement is a healthier community, bringing together individuals and care providers through the power of movement. So we're going to start by talking about the history of Courage Health, how we got started. We're going to talk about Dr. Kimmel and his vision, and then we'll get into where we are today and then the future. So Dr. Kimmel started the program in 2001. He was an oncologist. He practiced in East Texas for a long time. And the program was originally founded as a cancer-only program. Started as Cancer Foundation for Life, and the signature program was called Footsteps for Life. Since its founding, we've had over 28,000 patients get referred to the program. It's really very incredible. So Dr. Kimmel recognized that his patients that were physically active had better outcomes, they had increased survival rates, they tolerated treatment better, they had fewer side effects. And he also recognized that in spite of these very obvious benefits, there wasn't a program that existed for those patients to attend. There wasn't insurance reimbursement for cancer rehab the way there was with cardiac rehab. And so what he did was he just created his own program. He started the program in 2001. He made it free because he recognized the huge financial burden that came with a cancer diagnosis. And he was so far ahead of the curve because he did this in 2001. It was not until 2010 that the American College of Sports Medicine stated that cancer survivors could safely exercise. In 2018, the Clinical Oncology Society of Australia recommended exercise be integrated into treatment for those with cancer, actively with cancer. In 2022, ASCO, the American Society of Clinical Oncology, released the first formal exercise guidelines during cancer treatment. So Dr. Kimmel was, in some ways, 21 years ahead of the curve when it came to applying exercise for people with cancer. So he was very visionary. He started out delivering treadmills to people's homes. And he wasn't just delivering them, he would deliver them and work with them in their homes to help them progress and get stronger. And so definitely very selfless. Started out with delivering treadmills in people's homes. We expanded then to operating 16 in-person centers, and then we have a rapidly expanding virtual community as well. So we just kept moving forward from his original vision. In 2022, the board decided that we needed to expand. And so we opened up our program to include all chronic health conditions. We made that announcement officially in 2023, and we unveiled Courage Health as our new identity. So, because we felt that honored our roots, because a lot of the thought that went into the logo, it incorporates a lot of the elements of Dr. Kimmel and his vision. And so we wanted to make sure that we still incorporated that into our program as we moved into the future. The fun fact, Dr. Kimmel never accepted a salary from Courage Health, and he supported the organization with his own personal gifts year after year. So the people behind Courage Health are really what make it great and what keep us moving forward. So not only are we growing in terms of the number of lives that we've impacted, but also in the size of the team behind the mission. We started out with a very small board of directors, a handful of employees, and now we have an entire network, clinical, administrative, research, development professionals, and they work very hard every day to advance our vision, keep Courage Health moving forward, growing, and to continue serving the people that we serve. So we've been able to strengthen partnerships, pursue research, and reach more people than we ever have before. And I'm very proud of the role that I've been able to play in that. Our board of directors, so they are a huge part of what we do. They work very hard behind the scenes, often quietly behind the scenes. They step up to help raise money and awareness for our program. They help out at events. And of course, their biggest challenge is making sure that Jennifer behaves. So obviously supporting kind of the very early years of our program when we were just one center to now supporting the program, across our 16 locations and then virtually as well. They've embraced innovation, they respond to emerging community needs, and they've helped us create a really bold plan for the future, which we'll learn about when we talk about our strategic plan going forward. So this is our list, our current board of directors. And that was Greg Kimmel on the previous slide, by the way. That was Dr. Kimmel's son, and he was our past board chair. Our current board chair is Bill Newbern. And I wanted to make some note of some people that aren't on this list that were pretty impactful. So Dr. Ward is our current medical director. Dr. Sasha Davis, she served as medical director after Dr. Kimmel's passing. So we really appreciate her stepping into that role and doing that for us. And then we recently added a therapy director, that's Jenny Choate. So we're very excited to bring him on board as well. And I also wanted to acknowledge Dr. Barbara Haas, who's not on this slide, but she was there at the beginning helping us with research, and she continues to do so today. And this is the leadership team. So probably some familiar faces here. I actually hired Jennifer, and I'm really sorry about that, everybody. I'm obviously kidding. As Jennifer often says, that was the best decision that I ever made. Was hiring her. And then me, and then Wendy, who has been an absolute rock for the organization, and Wendy is the subject of our fun fact. She was the first full-time employee for Courage Health. From the very early days to today, she's been a huge part of what we do. Sorry about that. And this is the rest of our leadership team. So we have Cooper, Lindsay, and Jacob. So these are really the foundational leaders of our clinical team. So they're responsible for making sure that our exercise specialists are trained and equipped to serve the people that we serve. They do a fantastic job. Chances are, if you're in the Courage Health program, it was one of their voices that you heard when you got the phone call to get scheduled. So we really appreciate what they do. We couldn't do it without them. So they also represent us in conferences, health fairs, expos, and they do a great job. The exercise specialists. So I really can't say enough great things about our exercise specialists. They're our boots on the ground. They engage with patients day in and day out. They're the face of Courage Health for our patients, and for many of our patients, that is Courage Health. They're exercise specialists. So that's the person that they turn to when they need advice about their program. or sometimes they just need somebody to vent to if they're frustrated, or someone just to give them a word of encouragement, just to help them get them through their exercise session or get them through the day. So our clinical leadership team actually all started as exercise specialists, including myself and Jennifer. So we really like to promote from within. And so we really want to grow those leaders that we see amongst our exercise specialists. So they create individualized programs that build lasting relationships, and they help patients improve their strength, independence, and quality of life. We also provide opportunities for internships. So we partnered with colleges and universities. Most of our interns actually come from the University of Texas at Tyler and UT Arlington. So they get an opportunity to have hands-on experience while working alongside our exercise specialists and our clinical leadership team. And they get to learn the impact of medical exercise on chronic illness. I think it's also beneficial for people that are pursuing degrees in exercise science, that they see something that's available to them outside of something like physical therapy or occupational therapy as a way to use their education and be able to serve patients and help people. So it provides them maybe a different route to go. We also work with the UT Tyler School of Medicine. So the lifestyle medicine residents, they come and observe our program, and they get a chance to see us working with patients. And what that really does for them is that it helps them to get insight into whole person care and the role that community-based programs can play in improving health outcomes. And then for us, it is introducing our program and what we do to new physicians, and as they start practicing, they'll remember that and hopefully send us patients, refer patients to us for us to help. And you can see over the years how we've grown in terms of the number of staff. Starting out with 0, and I think in 2003, Wendy would have definitely been one of those 2 that was here. And actually, originally the program was staffed with nursing students. And Dr. Kimmel sort of recognized that while nursing students were fantastic, especially with the medical side of things, sometimes with the exercise stuff, it was a little bit more challenging. So he decided to begin hiring exercise specialists that were degreed in kinesiology, exercise science, and then sort of training them more on the medical side of things. I'm especially proud of our fun fact that during the COVID-19 pandemic, we never cut staff hours. We never eliminated positions. Thanks to our board of directors and the leadership team, we were able to keep everybody employed at the same number of hours that they were employed before COVID. And that was in spite of our centers being closed for almost a year and a half. And what it also did was, while the centers were closed, it allowed us to begin our virtual programming, which we've continued to this day. Okay, so now we're going to get into some of the program stuff, some of the services that we offer. So individualized exercise programs, and we're able to create those through our initial visit process, and that includes baseline assessments. So we're actually looking at medical history, exercise history, goals. We do a number of physical assessments. So we do a neurologic motor exam. We do a grip strength assessment. We do a functional reach assessment to evaluate balance and core strength, and a 6-minute walk test to establish a baseline for their cardiorespiratory fitness. And we also use quality of life surveys. And we take all that information and we use that to establish their exercise program. And then we perform reassessments at 1 month, 3 month, 6 month, and 1 year intervals. And that allows us to make sure that the program is effective and that they're getting out of the program what they need. We offer group exercise classes, so not at all locations, but many of our locations have group classes available. We also offer virtual programming. We have 17 Zoom classes per week that we offer. We also have a dedicated virtual exercise specialist, and she'll work with people one-on-one from their homes. We offer health and wellness education, so through things like KourageConnects. And we also will go and speak to university classes or high school classes as well to provide education on health and wellness. Transportation assistance. So this is something that we rolled out last year here in Tyler, and it's a program that we're looking to hopefully expand. But we receive funding to provide transportation support for those that need it here in Tyler, and we're very, very thankful for that. Caregiver participation and support. So we provide an opportunity for caregivers to exercise alongside their loved one. And we're looking at ways to expand the support that we can provide to caregivers as well. We engage in community outreach. So we actually will volunteer. So we've worked with the food pantry or East Texas Food Bank. We've worked with them to volunteer time. And we've also done numerous conventions, expos, and health fairs. And we also engage in research initiatives. And we've actually been published several times, and we'll get more into the research here a little bit later on. Kind of our plans there for that. And this is a glimpse of our locations over the years and how we've expanded and grown. And we've had ups and downs in terms of locations. We've had locations that have closed and others that have opened up. So it's not necessarily as linear as this would suggest. But overall, we keep growing and keep moving forward. So we get asked a lot, can we get a Courage Health location here, or what's the plan for expansion? Can you come here? Will you be here soon? And we'd love to be everywhere. And the answer is that it's complicated to get a center started up, but we're always open to ideas and options and finding ways that we can explore opportunities to expand our reach. But sustainable growth does require that we have strong local healthcare and community partners, philanthropic support, and a space that can be provided in kind. So we're definitely committed to growing our mission and bringing Courage Health to more communities. Actively in progress right now is Lufkin. We're in the process of identifying a location for our Lufkin center. But that would be the next center most likely that would open up. We're also looking at Athens, Dallas, and Longview for potential locations as well. So in the years to come, hopefully we'll be able to be in those communities. Our virtual participation has become a huge part of our program, and thanks to that virtual programming, like I said, we have a dedicated exercise specialist that will work with people one-on-one to create a home plan for them. It's a similar evaluation process to what we do at our initial visit, minus the physical assessments. But we've been able to create a very successful virtual program. Those patients get worked with one-on-one, either through Zoom or over the phone. And we also offer those group Zoom classes as well, 17 per week. And it's actually allowed us to expand our reach to 41 states and 5 countries. Of course, the United States is included as one of those countries, but we have 4 other countries that we're in as well. All right. So innovation and research. So Courage Health was started thanks to Dr. Kimmel and Dr. Haas with a foundation of research. Thanks to their efforts, we were published several times. And it really helped to establish the efficacy of a community-based exercise program like Courage Health. So we continue to partner with healthcare systems, universities, researchers to continue looking for opportunities for research and ways that we can collaborate. So like I said, Dr. Haas spearheaded our research efforts from the beginning. We've collaborated with University of Texas at Tyler very closely, Texas Oncology, Baylor Sammons, MD Anderson, and UT Arlington. We were able to present our research at the American Society of Clinical Oncology Conference in Chicago. And the ASCO conference is the biggest cancer conference that exists. It's enormous, so that was a huge honor to be able to do that. And research really positions us as a leader in the application of exercise for people with chronic health conditions. We're going to continue collaborating and looking at opportunities for large-scale studies, along with case studies looking at individual patients and their outcomes. And we want to continue to innovate, not just with the equipment and technology, but just finding new ways that people can access our services and our program, regardless of where they live. And so that's a big focus for us going forward. We're also very excited. For the first time in our history, we have a headquarters location. So this is combining our admin with an actual center. And the vision for the headquarters was really about being able to serve patients in a way that Courage Health hasn't really been able to do before through using very, very specialized equipment. And we were able to secure grant funding for that to allow us to provide really top of the line equipment to be able to really meet a very specialized need for our patients. And our grand opening is coming up very soon. It's Monday, June 22nd. So I think we've sent out an email about that. This is some of the equipment that we have available in the headquarters currently, and actually, well, one piece is at UT Tower, but I'll talk about that. So starting with the top left, we have a Barahab PT table. This is an extremely versatile piece of equipment, not just in terms of what it can do for our patients, but also in terms of comfort and safety for our exercise specialists. So they're actually able to more easily work with patients that really need that extra support. So it functions as a PT table, but it also has features and functionality that allow for patients to get support with standing. So it can actually help them move from a seated position to a standing position. And then from that standing position, then they have a lot of flexibility to do a lot of different exercises. Being in a standing position carries a lot of health benefits, in terms of their cardiorespiratory system, in terms of their balance, digestion, and then also sort of emotional and mental well-being as well. For someone that spends most of their time seated, having the ability to stand for a period of time is extremely beneficial. The top middle picture there is a strap stand. So it actually allows us to again, help a patient stand up that maybe is unable to do so. It's actually specifically designed for somebody with paraplegia to be able to stand. And then again, once they're in that standing position, you can do a host of different exercises with them from there. The top right is a light gate. So it's a harness system that allows patients to have a portion of their body weight supported as they're walking. This can be positioned over a treadmill, so somebody can walk on the treadmill while they're getting that extra support, or they can do free walking. This allows the exercise specialist to potentially actually manually move their limbs, their legs, to help them improve their biomechanics and their gait. So we're very excited about having that available. The bottom right is a Hoyer lift. This helps to facilitate patient transfers, so moving them from their chair onto the PT table so that we can work with them there. And many of our patients, enjoy that feeling of safety as they're being transferred from a chair to the PT table. The bottom middle, that's the Biodex balance system. And that's used as an assessment tool for balance. So we can actually assess patients' postural stability and their limits of stability. It's also a training tool because it has different modes and games in there that allow people to, like for example, as they shift their weight, they can move a little ball through a maze on the screen. And so we can also record and track their progress and how their postural stability and limits of stability are improving as they progress. So we're very excited about that. And then the last piece there on the bottom left, this is the C-mill, and it's actually not housed at our headquarters. This was acquired by UT Tyler. So a big thank you to UT Tyler and Dr. Barbara Haas particularly for helping us get this piece of equipment into that facility, because we recently moved on the UT Tyler campus into the new School of Nursing building. And so it allowed us to have the space to have that C-mill treadmill. And really what it does is it can do a lot of it has a lot of the functionality of like the light gate and the Biodex balance system, but packaged onto a treadmill. It can actually project images onto the belt as people are walking that they have to step over and maneuver around. So it's a very dynamic tool for helping people improve their walking, their biomechanics, their balance, and their stability, all while they have that harness there for safety. So it's a very, very exciting piece of equipment. And of course, it tracks. There are cameras that are watching your biomechanics as you're walking on there, and you can actually track their gait pattern very, very well as they're moving on that seam mill. All right, philanthropy. So this is how we keep the lights on. So our programs and services, obviously, we provide our program free of charge for the patient. Obviously, the program is not free, though. It does have a cost associated with it. This is our annual operating budget. So it provides programs, staff, equipment, technology, research, outreach, and support services. The average cost per participant, $300 per participant per year. I do want to stress, though, because we've had people that, when they found out about that number, they'll say something like, well, okay, I don't need this that badly. I can just not go and save you the money. That's not how it works, because the more people that we have attending, the less it costs us per patient. So keep coming. But that investment in patients provides access to unlimited participation, individualized exercise programming, assessments, the educational opportunities, and then the ongoing support as well. All right. So how do we get funding? So we have individual donors, and that's really the heart of our philanthropy program. Without the generosity of the individual, our program would have a very hard time existing. And everything counts. Everything makes a difference. Grant-making foundations. So they help to provide kind of critical investments in programs, equipment, transportation, and growth. Funding for example, the equipment in the headquarters, that came from a grant-making foundation. And I'm not going to mention specifics as far as the specific foundations, because I don't want to leave anybody out, and I know that I would do that. Healthcare and community partners, so organizations that provide support, collaboration, and in-kind resources. And then through our events, Courage Classic Golf Tournament, Spirit of Courage, Giving Days, other initiatives, any sort of fundraising event that we do in the center, our walkathon that we do with our patients every year, it all adds up, and that's where we get a lot of our funding. The fun fact, the value of the donated space and in-kind support from the community partners, it's well over hundreds of thousands of dollars annually. And that really allows us to direct more resources towards patient care. So without those in-kind donations of space, we really wouldn't be able to run the program as it is. I also want to acknowledge our volunteers. Over the last 25 years, volunteers have been a huge part of the growth of our program. They are ambassadors, they're mentors, they support us during events, they're advocates for our program, and many of them have become friends over the years. They help create a sense of camaraderie. They create a very positive environment for patients when they come in. And it's good because you see someone that's a peer. Most of our volunteers are either participating in the program themselves, or they've been participants in the past, and so they've had similar life experiences. They've had their own experiences with chronic health conditions, that maybe our exercise specialists haven't. And so it gives them a way to kind of pour into our patients that maybe our exercise specialists, can't, because they have that similar well of experience that they can draw from. So their willingness to give their time and talents, it allows us to reach more people. It strengthens our program. It ensures that every patient feels seen. We really wouldn't be able to do what we do without our volunteers. All right. So earlier this year, we got to all come together, the board of directors and the leadership team, under the guidance of Brian Brandt with Core Insights. He donated his time to help us there, and we really, really appreciate that. But the idea was that we want to create a strategic plan to carry us through 2030, to think about where we want to go, how we can serve more people. and what we need to do to make sure that Courage Health stays strong for years to come. So making sure that we have a sustainable model, and keeping us grounded in our mission and our values that have guided us from the beginning. So we actually have a very exciting strategic plan that we're really pumped about, and we're ready to implement it. So we are very proud of what we've accomplished over the last 25 years, and we think that the greatest opportunities are still ahead. So this slide is really about kind of what we're looking at in the future and how we want to grow and expand. So a big focus is expanding access. We want to look at ways that we can increase access to our program, and a lot of these other kind of subheadings here are related to that. So things like expanding transportation assistance will help improve access. Adopting new technologies and innovations will also help us improve access, and then pursuing growth and new centers where we can. Virtual growth, enhancing virtual programs to reach more individuals across the country and around the globe, and also in Texas too, because even in East Texas, there are a lot of areas that we still haven't reached. There's a lot of members of the rural community that would really benefit from our services, and so we need to explore ways to get access to them as well. New technologies and innovation. We're looking at utilizing things like apps or other tools that could improve our programs and our outcomes. Also tracking patient outcomes and the way that we do that, and tracking really our patients' exercise programs in general. Updating therapy tools and equipment, refreshing and expanding our equipment to meet the needs of our patients. So we've actually done I think a good job of that over the years, of adding new equipment into the centers to give a broader range of options for our exercise specialists and for our patients. We want to really focus on research and outcomes. Demonstrating improved outcomes will help us with expanding the program. As we are talking about the program to new potential referring providers, they want to know about outcomes. What types of outcomes are we seeing with our patients? How are they improving? And also looking at ways that we can reduce healthcare costs too. Expanding transportation assistance. So right now we offer this in Tyler, but we want to eventually grow beyond just Tyler for transportation assistance. And then sustainable growth and access. Ensure that Courage Health remains strong and available at no charge for future generations. So we want the program to continue to follow Dr. Kimmel's vision of being free of charge and having no cap on attendance. And then further down the road, having a headquarters in the DFW area similar to what we have here in Tyler, that will allow us to have that flagship location in the North Texas area. All right, so as I'm wrapping up here, I want to give everybody kind of a call to action, kind of some ways that you can help us as we move forward. Number one is stay engaged. Continue investing in your own health and wellness by participating in the program. Show up to KourageConnects, even if it's me presenting. Trying out new exercise classes, encouraging others to stay active and connected. So just stay engaged with us. Share the mission. So talk about Courage Health with friends and family. So many of the people that find out about Courage Health, they find out because they have a friend or a family member that's benefited from the program, and then they told them about it. So share your experience and help spread the word. Connect with others, and tell them about kind of the hope and encouragement that you've gotten from participating. And then finally, give back, if that's through volunteering, sharing your story, attending events, making a financial contribution. There are all kinds of ways that you can help. And again, that helps to ensure that we stay free of charge for the future. So thank you so much. We're gonna move into the Q&A session, and I'm gonna leave this screen on here with ways to get in touch with us.
Trevor, there's one question from the chat from Diane about how does someone apply to use Zoom services if they're out of the state?
Sure. So I think the easiest way is to use, so there's a couple different ways. You can either call our office, which you can find that office number on the website, and then we can seek out getting a referral for you. That's probably the best way to do it. You can also submit a form, a submission form through our website, and that will then email us your interest in joining. But really the best way I think is just to go to the website, get the office number. And I think Wendy, if you could type the office number into chat as well, um, or I think it's on the screen actually.
I was
Yeah,
about to say it's on the screen right now.
perfect. It's on the screen. So call that office number and say, hey, I want to get started in the Zoom classes. What do I need to do? And then what we'll do is we'll initiate the referral process if needed. Now, if you could get a referral from your doctor faster, if you have that type of relationship with your physician, then that's great. You just need to have the referral in hand, and then you can scan and fax it to us, or you can email it to us. And then that would allow you to get access to the Zoom classes. And then once we receive that referral, we'll set you up to have an evaluation with Ange, our virtual services, our virtual exercise specialist. Does anybody have any questions? I see Sharon. Thank you for that feedback. Really appreciate that. We also love Plano and we love Maya. Maya's fantastic. All right. Well, if there aren't any other questions, then I guess we'll go ahead and wrap it up. Thank you all so much for attending. I'm doing my very best to make sure that in July it won't be me doing the Courage Connects. But yeah, thank you so much for attending. Really appreciate it. And yes, thank you, Dr. Hermans. We appreciate you as well. Dr. Hermans is a member of our research council. So thank you. All right. Well, we'll go ahead and wrap it up. So thank you all again. Appreciate it. And I hope you all have a great day and a great rest of your week.